The battle to end the scourge of HIV/AIDS in Guyana has seen some amount of progress over the past 10 years. According to UNAIDS in 2015, 60% of patients were receiving antiretroviral therapy (ART) compared with 20% 10 years ago. Despite progress with treatment, Chief Medical Officer Dr. Shamdir Prasad is urging more advocacy to further educate the public about the virus.
However, we still have some worrying trends. One of it, for me, is the semblance that we still have young people, people are newly becoming sexually active, becoming infected. That means that we're probably having new populations of persons who don't fully understand yet these risks. We still have people, even in the other age groups, who are taking a lot of chances.
At a recent press conference, Minister of Public Health Dr. George Norton revealed that about 500 new cases of HIV are recorded annually. Dr. Prasad further spoke of one scenario which might be helping to maintain that long list of infected persons yearly.
The mothers are going, they got their first baby, they're HIV positive, and the baby comes out negative and they can live a happy life. They're going for a second and even a third or a fourth child. So treatment is giving people that freedom now to, go on and maybe put their guard down a little. That could be a little worrying.
UNAIDS has set a target that by the year 2020, 90% of all people living with HIV will know their HIV status. 90% of all people with diagnosed HIV infection will receive sustained antiretroviral therapy, and 90% of all people receiving antiretroviral therapy will have viral suppression. Dr. Prasad is of the view that in order for Guyana to achieve that goal, there is need to change strategies.
It would be really challenging for all of us in terms of so really and truly, and the campaigns, we need to look back again at the campaigns, look back again at who they're reaching. There are particular vulnerable groups that needs to be addressed, and personally I think the stigma and discrimination is still there, and it's causing a lot of people not to come forward and be open about their status.
The Ministry of Public Health will be participating in an upcoming United Nations high-level meeting on HIV/AIDS to be held at the United Nations headquarters in New York from June 8th to 10th, 2016. For HGP Nightly News, I'm Jessica Daw.